Here.
McGilvray.
Here.
Jackson is absent with notice. Nelson.
Here.
Cavell.
Here.
Gingell.
Here.
Kuhn.
Here.
Lubes.
Here.
We have a quorum.
Thank you. Please join me and rise for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Next item is approval of the minutes from September 14th and September 24th. I have a motion by Commissioner Gingell, support from Commissioner McGilvray. All in favor say aye.
Aye.
Opposed? The minutes are approved. We have an agenda to approve. If there are no corrections, I need a motion. Motion by Commissioner Nelson, support from Commissioner Hoffman. All in favor say aye.
Aye.
Opposed? Motion is carried. Our next item is public comment for comment on the agenda. Is there any public who wishes to comment? If you do, please come.
We have a list that's going around down here right now.
Sorry, where are we at?
This is for public comment on the agenda.
Oh.
Right.
Okay, thank you. Well, if somebody would like to step up to the microphone, state your name and your city. And you have 3 minutes.
Thank you, Chair and Commissioners. My name is Catherine Kennedy. I'm from Lake Orion. And I see we have the seed loan fund on the agenda today. We talked about this one before. This is one I actually thought was kind of unconstitutional, so I'm glad to see it's been brought back to the agenda. This is a minority loan program where Oakland County is paying $1.3 million and to get a grant for $1 million, and giving the $300,000 to the other agency to manage it separately. Now, the agency itself is actually a business. It's in the business of making loans. And they look to be like they created their business to make loans for governments, which to me is a little odd. But that's something I think we need to evaluate. Was this even something that's bid? Why? We used to have a loan program that was run by our own county. We seem to give a lot of the grant money to other people, and I'm not sure how much accountability there is. There's a second item on the agenda today for the car theft regional agreement. And although I didn't get to go through this one in detail with too many pages again being given to the citizens and very little time to get through them, last time it was a situation where it was about $700,000 total, and Detroit paid 61 and Oakland County paid the rest. It just seemed like it was a taking advantage of the Oakland County Citizens Tax Initiative, which is also often the case on these multi-region initiatives or alliances. And I think we need to pay a lot more attention to the accountability that should be going along with all those things. And I appreciate that you're starting to look at some of the issues of the committee recommendations. And I'm very concerned about the Beaumont Health, Spectrum Health. That's something that's not on this agenda, but this is something that must be repealed, because the only thing that will accomplish for our citizens is add another bureaucratic level and create our medical system into a socialist medicine, which is not good for anybody in the country, let alone anyone in Michigan or the county of Oakland. So I appreciate your consideration of these matters. Please take into account the citizens want security. The citizens do not want socialism. The citizens do not want socialized medicine. And there's an awful lot of bail reforms and things that are not in the best interest of the citizens. The citizens should not be placed at the bottom of the list. Thank you.
Thank you. Would anybody else like to speak in the public comment regarding the agenda? Seeing none, public comment is closed. We move on to communications. There are 4 items in communications: a grant application for Empty the Shelter event, the intake disposition report from our animal shelter, a grant application from Friend of the Court Access and Visitation, and the last item is the 2021 MDOC compliance report. Is that,
Before we make a motion, may I say something?
of course.
And I don't know if this is the place to do this, and Andrea's got a copy of a motion I want to make, and she's going to pass it out in a second here, so just.
Is that a motion to fall
Well-
under communications?
I don't know where it should go, so I guess, yeah, if you'd pass those out, please, Andrea. And I don't know where it should go, but if you direct me to put it somewhere else on the agenda, I'd be happy to do it.
Oh, so this would have come under approval of the agenda, so your motion is to have,
No, I'm not adding this to the agenda.
then what is this motion for?
All right, let me read the motion, and then we maybe have some discussion on it. I move to have Adam Kokendorfer's resolution be placed on the pandemic ad hoc committee agenda, and a meeting be scheduled within 30 days from today to concur with the referral of Chairman Woodward at the last BOC meeting of September 29, 2021. That's the motion I want to make, because I know initially you said it would be on this committee, and then the chairman decided it should go to a different committee, and I have no problem with that, and I appreciate your help. But I want to make a motion to make sure that we actually have an ad hoc committee meeting.
Thank you. Commissioner Powell?
Can we even entertain this, and this has nothing to do with our committee?
Well, it wouldn't go under communications. We would need to amend the agenda to have that as a motion item. So, if we'd like to go back to the agenda and amend the agenda, we could make it under regular agenda after line item I.
Okay, but, different line item?
Yes.
Because I know it's not under, it's not to be put on this agenda, but it was referred to this committee originally, and the chairman was going to put it, the chairman of this committee was going to put it on this committee, and now the chairman of the board has referred it to the pandemic ad hoc committee, and that's why I want to make sure that we have a meeting to concur with his referral. So I did make a.
Commissioner Ginzel?
Sorry.
Yeah, thank you. So, Madam Chair, I think we could amend the agenda if you chose as the chair. Potentially, you could also address it under business. Other business could come before us. It is a motion, so it is actually an action of the board that we vote up and down. I think either one would be proper, but I guess from my position, I don't see this necessarily as controversial. This is just affirming what the chairman told us he was going to do in the last meeting. And since any committee can refer a matter to another committee, although I've never seen a committee refer a matter to an ad hoc committee, I guess it's possible, we just want to make sure that the ad hoc committee meets and that they actually take up the agenda item that they said they were going to take up, which is what was initially planned to be on this agenda.
I agree with you. I like the idea of amending the agenda to put it under other business. That seems the appropriate place for this.
Okay.
So are you making a motion to do that?
I'll make a motion to do that. I don't know if we need to, I guess we don't need to reconsider the
Well, we need a
approval
motion to
agenda.
amend the agenda and then to add this under other business.
Okay.
Okay.
And then we voted on approving the agenda already, right?
Correct.
So I'm assuming that we would have to either reconsider the approval of the agenda,
Correct.
add it, and then vote?
Correct.
Okay, so I'll move that we reconsider the approval of the agenda.
Okay. Support
I
from
support it.
Commissioner Hoffman. All in favor say aye.
Aye.
Opposed?
Opposed.
Okay, so do we need a roll call? Roll call, please.
On amending the agenda,
Reconsider.
reconsider, Powell,
No.
Hoffman,
Yes.
McGilvray,
No.
Nelson,
Pass.
Cavell,
No.
Gingell,
Yes.
Kuhn,
Yes.
Lubes,
Yes.
and Nelson.
Yes.
Five yeas and 3 nays. Motion carries.
Okay, thank you. Commissioner Ginzel?
Madam Chair, I'd like to make a motion that we approve the agenda with one amendment, which includes the request to address the Kokendorfer resolution referral to the pandemic committee under let's see here, hang on.
under other business, item 11.
Other business, item 11.
I support it.
So I have a motion by Commissioner Gingell, support from Commissioner Hoffman. All in favor, say aye.
Aye.
Opposed?
No.
That roll call, please.
Powell,
No.
Hoffman,
Yes.
McGilvray,
Yes.
Nelson,
Yes.
Cavell,
No.
Gingell,
Yes.
Kuhn,
Yes.
Lubes,
Yes.
6 yeas, 2 nays.
All right, motion is carried. We're back to communications now. 4 items under communication. Who would like to make motion by Commissioner Gingell, support from Commissioner Nelson? All in favor, say aye.
Aye.
Opposed? All right, communication is carried. There's nothing on the consent agenda at this time. We move on to our regular agenda. First item is contract transfer of ownership and release of claims agreement for K9 dog Mordus. So I have a motion by Commissioner Gingell, support from Commissioner Nelson. And we have our under sheriff and Gaya here to speak to this.
Good afternoon. Thank you, Madam Chair. This is a kind of a thing that we've done for many, many years. When one of our canines becomes too old anymore or on health issues, we retire the dog, and then we ask that the dog be sold to the handler for $1. We've done this many times for as many years as I can remember. The dog, as you know, stays with the handler at home, becomes part of the family. If anybody who are dog owners, you know a dog can basically be like one of your kids. So we're just asking for approval of that today.
Thank you. Any comments or questions? Roll call, please.
On item A, Hoffman,
Yes.
McGilvray,
Yes.
Nelson,
Yes.
Cavell,
Yes.
Gingell,
Yes.
Kuhn,
Yes.
Powell,
Yes.
Lubes.
Yes.
You have 8 yeas, 0 nays.
Motion carries. Thank you.
Thank you.
Our next item is similar, the transfer of ownership and release of claims agreement for K9 dog Bolt. I have a motion by Commissioner Hoffman, support from Commissioner Nelson.
This is the same thing. This dog has reached its capacity as a canine within the unit, and we're asking you to approve the sale of the dog for $1 to the handler.
Thank you. Comments or questions? Roll call, please.
On item B, McGilvray,
Yes.
Nelson,
Yes.
Cavell,
Yes.
Gingell,
Yes.
Kuhn,
Yes.
Powell,
Yes.
Hoffman,
Yes.
Lubes.
Yes.
8 yeas, 0 nays.
Motion carries. Item C is an extension with Haven to provide services to victims of sexual assault through the Safe Therapeutic Assault Response Team called START for fiscal year 2022. I have a motion from Commissioner Nelson, support from Commissioner Hoffman.
The history on this, I'm not sure if somebody from Haven is here.
Yes, we have Chantel.
I'm sorry, she
Yep,
dialed in.
actually, yeah, so we have Chantel Hammond, I believe, on the line, if you have any questions about the exam process, but.
So this is basically, the sheriff's office acts as a pass-through for this money to Haven, and this has been in existence for many, many years, and it's a great tool for police agencies throughout the county, and a great partnership with Haven, where, as you all know, they provide this service, and there's no charge to the victims of these assaults.
Thank you. Are there any questions? Commissioner Cavell?
Thank you, Chair. Hi, Chantel. I was looking through the supporting documents of this, and I'm curious, 2 questions. How big was the contract last year or in previous years? And also, I noticed there seems to be like an uptick in intimate partner violence. So is that going to be sufficient, or what do you see happening in the next fiscal year?
I believe in the past years it was $45,000. I agree with you. There has been a large uptake, and in addition to that, as you know, there have been nursing shortages. So we provide a very specialized a very specialized care to patients to be able to care for patients of sexual assault and intimate partner violence. It's an additional training that most nurses have to get. You can't just start doing this straight out of school, so we do have a shortage in nursing. But in addition, we have an uptake in a lot of our exams. In 2019, when I started at this program, I think we had 55 intimate partner violence exams total. Right now, as of October 5th, we've had about 75 patients so far, and the year has not even completed yet. I anticipate that number being close to 100 by the end of the year.
So then is this enough money to do the work you do?
If we could get an increase, that would be ideal. But of course, we are thankful for whatever we get from the commissioner's office.
Okay. Well, and Gail, you're the money person.
Right, so actually, this is a Board of Commissioners initiative that runs through the Sheriff's Office budget.
Okay.
So we actually reach out to, I think it was Patty, and Michael Andrews is the one that we usually work with. So obviously, this is your call. It runs through our budget. We're basically, like the undersheriff said, we're the pass-through. We're kind of the fiduciary for it. So, and then the board, I think you get emails. You get a quarterly report with all the statistics. So it's basically a collaboration. So that would be up to you if you want to increase the amount. I know there's been discussions in previous years, and then the $45,000 was an increase over, I want to say, a couple years ago. So that's up to you.
Thank you.
Thank you. Any other questions? Roll call, please.
On item C, Nelson,
Yes.
Cavell,
Yes.
Gingell,
Yes.
Kuhn,
Yes.
Howell, Hoffman,
Yes.
McGilvray,
Yes.
Howell,
Yes.
Lubes.
Yes.
8 yeas, 0 nays.
Motion carries. Thank you. Our next item is a grant acceptance for fiscal year 2022, the Automobile Theft Prevention Authority. I have a motion by Commissioner Hoffman, support from Commissioner Powell.
This is our
Thank you.
yearly grant from the ATPA. It's funded by a $1 surcharge on insurance policies. The grant is a 50-50 match. I can tell you way back when this started, it's 50-50, right? Okay, 50-50. It's varied over the years. At one time, it was 100%. There was no match. Then it was 75-25, and now it's 50-50. We have two teams. We have a South team, which is run by one of our sergeants at Southfield PD, and we have a North team that's housed here at our headquarters. You can see who the participants are. The city of Pontiac participates, but it's one of our deputies. But the city of Pontiac, unfortunately, has the most auto thefts in the county. Southfield is right around there. Southfield and Pontiac are about the same. Hazel Park, Royal Oak, Farmington Hills, the city of Detroit, and city of Southfield. Just so it's clear, the city of Detroit, we do not pay their match. Detroit pays their match, and we pay our match. City of Royal Oak, unfortunately, just had to drop out. We are looking for, due to staff shortages, not because they don't believe in the grant, but we're currently pursuing another South End department to participate in this grant, and we're pretty confident we'll find somebody to take Royal Oak's place. So we're asking today for your approval on this. We've been able to reduce auto theft tremendously in the state of Michigan as a result of this program. This program was started many, many years ago, I think 1986, I think. And it became a model for the rest of the country. They adopted what we have done here in Michigan.
Thank you. Commissioner Gingell?
Thank you, Madam Chair. So Under Sheriff McCabe, just a quick question. We had a resident early talking about wanting to ensure that Oakland County taxpayer dollars through this program aren't going to subsidize any activities in the city of Detroit or outside the Oakland County boundaries. And I think you mentioned it, saying that the Oakland County taxpayer dollars fund the programs that are within Oakland County. And I know that this is a program that we consistently passed under the Patterson administration and dating back to '86. So I think it's a good program. I'm going to support it. But I just wanted to make sure the citizens know that their taxpayer dollars are staying in Oakland County to circumvent auto theft.
Yes, sir, that is correct. Detroit makes their match. We have a deputy assigned to one of the Detroit teams, and Detroit has one of their officers assigned to our South End team at Southfield PD. And we've had that relationship with Detroit going back many years. It pays benefits hugely because, as you know, there's a large amount of auto theft in Detroit, and they come up to Oakland County and Wayne County, Macomb County, and Outer Wayne and steal cars. So it's a great relationship that we have.
Thank you.
Thank you. Any other questions? Commissioner Cavell?
Thank you, Chair. Under Sheriff, you're looking for a South Oakland community. I mean, Oak Park, I go to the.
I've already talked to him. He can't
They're
afford
not
to send
interested?
it. No, sir.
Why don't
I
they
beat you to
wanna-
the punch.
Yeah,
He's
good call.
staffing shortages. He's got 4 vacancies he has yet to be able to fill.
Okay.
Any other questions?
That was the first department I called.
Okay, all right.
All right, roll call, please.
On item D, Cavell,
Yes.
Gingell,
Yes.
Kuhn,
Yes.
Powell,
Yes.
Hoffman,
Yes.
McGilvray,
Yes.
Nelson,
Yes.
Lubes.
Yes.
8 yeas, 0 nays.
Motion carries. Thank you.
Thank you.
Our next item is acceptance of a donation of Steridol cleaning wipes from Lynn Medical. Who do I have a motion from? Commissioner Nelson, support from Commissioner McGilvery.
This is a township trustee by the name of Paul Brown from Independence Township, actually, is one of the principals in this company, and he approached us. They had a large inventory that was left over and wanted to donate it to the sheriff's office, and we'd be pleased to accept it to keep our jail COVID-free and continue to do the cleaning that we need to do and not have to buy this. And we've also worked with Homeland Security. They may be able to have, that's a lot, and it will not go to waste, I can tell you that.
Thank you. Any comments? Roll call, please.
On item E, Gingell,
Yes.
Kuhn,
Yes.
Powell,
Yes.
Hoffman,
Yes.
McGilvray,
Yes.
Nelson,
Yes.
Cavell,
Yes.
Lubes.
Yes.
8 yeas, 0 nays.
Thank you.
Thank you. Motion carries. Our next item is fiscal year 2022 contract interlocal agreement with Oakland Community Health Network for mental health co-responder licensed clinician. I have a motion from Commissioner Gingell, support from Commissioner Cavell.
We're pleased to bring this forward today. We worked in conjunction with Commissioner Cavell on this, and I'm going to let Gaia explain to it exactly what we're doing, but it's something that we've been doing many things in this realm, and this is going to help us expand this service.
So if you recall, in our budget request, we had asked for a behavioral health practitioner position, which was granted. And then as we were working with Commissioner Cavell and with OCHN, so we have Kathy Yunker here from OCHN, they actually gave us a proposal on a co-responder model, which is what we were looking to do. So we asked during the budget wrap-up to transfer the funding for salaries and position, basically the personnel budget, into a professional services line item so we could actually contract with OCHN. So that's what you're seeing as a result here, the interlocal agreement with OCHN. And I have to thank Kathy, and I have to thank Mary Ann Yerge, who was here earlier at the Lago meeting from Corporation Council, and Katie West from the Sheriff's Office. They have turned this around in record time for us to get it to you, because we obviously wanted to get it approved so we can get this model rolling sooner rather than later. So we appreciate your input, Commissioner Cavell, and we're looking for your approval today.
Thank you.
I could add, we have a great relationship with OCHN. As you know, we do the same thing with our psychiatrist in the jail. We're one of the few county jails that provide psychiatric services through their generosity, quite frankly, in order to serve that population within our facility.
Thank you. Yes, and OCHN staff are experienced and would be able to manage this.
They have an existing agreement with a couple other local agencies, so we were just able to kind of modify that agreement, obviously, to meet the county's needs and their needs. So we felt this was a way to get the program up and running a lot quicker than if we were, tried to hire somebody outside.
Thank you. Any other questions? Commissioner Cavell?
I just wanted to say, for the sheriff's office to be so forward-thinking and have the foresight to want to do this and pull the trigger and make it happen, OCHN, just hats off all around. Way to go, you guys.
Thank you.
All right, roll call, please.
On item F, Kuhn,
Yes.
Powell,
Yes.
Hoffman,
Yes.
McGilvray,
Yes.
Nelson,
Yes.
Cavell,
Yes.
Gingell,
Yes.
Lubes.
Yes.
8 yeas, 0 nays.
Motion
you.
carries. Thank you.
Thank you very much.
Thank you for spending your morning with us.
Our pleasure.
Our next item is a budget amendment to create one Homeland Security Specialist position. I have a motion by Commissioner McGilvery, support from Commissioner Nelson, and we have Tom Hardesty here to explain this item to us.
Thank you, Chair. Good morning, Commissioners. Since just a month or two into the pandemic, we were fortunate that we received, Kevin Sadage was reassigned from Veteran Affairs to the Emergency Management Homeland Security Department. For all but maybe a few weeks, he's actually worked in our office. He came to us, he is a veteran himself, but he came to us with a skill set that also included public information officer, has done a ton of work for us over the last year and a half and has really jumped in with both feet. He's taken all the National Incident Management courses. He's taking courses to become a professional emergency manager. On top of that, we brought him in temporarily, not really sure how long the pandemic was going to last. Initially, some work slowed down in Veteran Affairs, but unfortunately, our work has not slowed down. In addition to the pandemic, we have seen floods this year, just had our second tornado in Oakland County this year over the weekend. So our work is not slowing down, but Veterans Affairs still has work to do and still needs to serve the veterans of this community. So we had asked to move Kevin off the Veteran Affairs payroll and onto a temporary position. We're not looking to fill this forever. We're looking to use, American Rescue Plan dollars with a sunset clause in here through 2024. If the pandemic quit today, we would have 18 months of work just on the pandemic, much less the other work that is somewhat behind because of that. So that's the reason we're asking for this, and also to allow Veterans Affairs to backfill their position. And Kevin, who would be that person, understands that this is a sunsetted position.
Thank you. Any comments regarding this item? Roll call, please.
On item G, Powell,
Yes.
Hoffman,
Yes.
McGilvray,
Yes.
Nelson,
Yes.
Cavell,
Yes.
Gingell,
Yes.
Kuhn,
Yes.
Lubes.
Yes.
You have 8 yeas, 0 nays.
Motion carries. Thank you.
Thank you.
Our next item is a resolution for appropriation for FEMA reimbursable pandemic response activities. We have a motion by Commissioner Hoffman, support from Commissioner Powell.
Thank you again, Commissioners. This is a request for an allocation. We're estimating a little over $7 million in expenses for this fiscal year 2022 for those that would be FEMA reimbursable. It's important for FEMA reimbursable funds that they not come out of any other grant. If we initially, for example, paid them out of ARPA grant, then they wouldn't be eligible for FEMA reimbursement. So we're asking for the allocation out of the general fund because that makes us eligible to get these monies back from FEMA. As you know, it doesn't come quickly. We're averaging right now about 18 months for us to get reimbursements. We're expecting deposits for finalized approvals a little over 1.3, 1.4 million, with another over 5 million still pending from expenditures over the last year and a half, but they are moving through this. A big chunk of this, again, this is an estimate, is what we estimate for testing. Currently, as you may recall, the Sheriff's Department has been under a federal lawsuit, so we've been doing testing for all 1,200 and some staff of the Sheriff's Department twice a week. There are potential further regulations coming down from the federal government that could cause us to have increased employee testing. The one benefit is FEMA came out with guidance that said testing will be a reimbursable expense, and that's not something that was in their original guidelines, so we're actually seeking that going all the way back to day one to try to get that reimbursement. And then some other items in there continuing to support the vaccine sites, medical supplies, ambulance, site rentals, communications costs, those that are specifically related to COVID-19 and the vaccine, those are FEMA reimbursement eligible. And then to continue to stock our PPE, we've made most of our initial purchases, but we're still using it. Our communities are still using it, so this is just to keep us stocked up. And then staffing to manage the warehouse. We use temporary services for the warehouse and to support some of the vaccine sites again, because we don't anticipate this being a hopefully not a forever event, that at some point we'll be able to cut that back.
Thank you.
And then finally, these expenses, I heard you mention the pandemic committee earlier, that we would take these specific items to the pandemic committee for approval for expenditures.
Thank you. Any other comments? Commissioner Cavell?
Thank you, Chair. Hey, Tom. So the contracted services will go through the Pandemic Response Committee for final approval.
Yeah, so right now, the COVID-19 test, we are under a current bid. Scott Guzzi, who's the purchasing agent, I had talked to a few weeks ago, and our plan would be to rebid it anyway. We had more than 10 companies bid originally. We feel we have, it is expensive, even though we feel we have a good price, but it would be rebid for two reasons. One, who knows, maybe prices have come down as we're into the pandemic. And the other is we would like to rewrite the bid to open it up so other communities could attach onto those bids as well.
Okay. And now, when we had talked about something like this before, you had said it would cost roughly $5 million-ish.
That is an estimate, yes.
Okay, so, all right, got it.
That's not to pay for other communities. That's just
Right.
would be Oakland County expenses.
But these contracted services, or this $7 million, would allow for space, if there was a rebid, to include other communities?
Well, we want to have the bids be so that other communities could buy at that price.
Got it.
Again, we wouldn't be paying for them, but at least they would have the advantage of the purchasing cooperative to hopefully get a better price.
Understood. Okay. Thank you.
Thank you.
Oh,
And Commissioner Cavell for a second time?
sorry, Chair. So to make sure I'm keeping track of the general fund COVID-related expenses, January was $10 million.
Yes, sir.
Then you were able to get $8.3 million back.
Well, we only obligated 8.3.
Okay.
So we didn't spend 10 million, and actually we haven't even spent quite up to 8.3. So we will put back all of that 10 million, whether it's from FEMA or some of it through a health grant.
Sure.
And then this, as we've now gotten a better, I guess, feeling from FEMA, what's eligible, what's not eligible. So that's why we're focused this year on really on FEMA expenses.
And so this $7 million should put us through the duration of the fiscal year.
Assuming things don't change significantly,
Right.
yes.
Okay, understood.
If
Okay.
they did, we would be back asked.
Okay, thank you.
Thank you. Roll call, please.
On item H, Hoffman,
Yes.
McGilvray,
Yes.
Nelson,
Yes.
Cavell,
Yes.
Gingell,
Yes.
Kuhn,
Yes.
Powell,
Yes.
Lubes.
Yes.
8 yeas, 0 nays.
Thank you.
Motion carries. Thank you, Tom. Next item is a resolution for the appropriation and grant administration plan for the Mental Health and Wellbeing Emergency Room Services Grant Program. We have a motion by Commissioner Powell, support from Commissioner Nelson. And we have Hillary Chambers and Laura Appel here to speak to this.
Good morning, Chairwoman Lubes and members of the Public Health Committee. Thank you very much for having us. I am joined today by the Senior Vice President at the Michigan Hospital Association, Laura Apple. Just by way of background, this is a follow-up resolution to a resolution that the board approved earlier in the summer. You'll remember when we reconvened the COVID Economic Recovery Task Force and started to talk about the very acute needs that the county was still facing because of the pandemic. One of the issues that repeatedly came up from all of the work groups was the mental health issue. And so we came to the board with several different proposals, and you approved $14 million, 10 million of which has already been utilized for the nonprofit mental health grant. Those grants are well underway, as you know, operated by the United Way for Southeastern Michigan. This is the second tranche of that money that you set aside to address acute mental health issues within the county. And this has to do specifically with a concern that our hospital systems have in their emergency departments. So really, with Laura's leadership and the leadership of several of the hospital systems in the county, they came to us earlier in the summer to explain a concern that they had with patients in their emergency departments who were basically lingering there for weeks at a time and are still lingering there for weeks at a time, waiting for an inpatient or outpatient mental health referral. And what happens when that's the case is they are not getting any type of treatment for their mental health issue while they're in the emergency departments. So what we're recommending in partnership with the the Michigan Hospital Association and all of the hospital systems in our county is for the next year, because of the pandemic, that we would, on a reimbursable basis, up to $2 million, allow the hospitals to utilize their staff to begin to provide mental health services for patients that they have in the emergency departments who are awaiting a further referral, either inpatient or outpatient, that would occur outside of that emergency department. So what you have before you in the resolution and the supporting document details out how that program would operate. I mean, it's pretty simple. We did want to have the Michigan Hospital Association help us administer the program because of their expertise and their relationships with the hospitals. We have talked to each of the hospitals about what they're facing in their emergency departments, and they've provided us an estimate in terms of what they feel would cover these costs for the next year. Again, this is just an acute need that we're addressing for this period of time. And so each of them have provided an estimate, and that is, at this time, that is the allocation that we would envision flowing to each hospital system. Now, it would be done on a reimbursement basis. So they would have to provide the treatment and submit that to MHA, who would validate it and then reimburse them from the $2 million. So that's basically the sum and the substance of it. Again, it's addressing, what is an acute emergency need. It's not a long-term solution, but our hospital systems were significantly concerned about this. And also, it isn't a good situation for our residents who are lingering without any particular treatment at this time. So Laura's joined me to help with any of the substantive questions, and we would open it up for that at this time.
Thank you. I believe it is well needed. I do work in mental health, and I know that at times people are in the emergency room and wait for a bed, and sometimes that wait could be 2, 3, 4, 7 days long for a bed to open up. So this fills this gap. Thank you. Any questions? Commissioner Gingell?
I was just going to comment, too, that while we're doing this as part of COVID, I do think it's something we should make sure we're paying attention to see if we can learn for implementations long-term. Even prior to COVID, we used to have and still have the situation where there are people in the emergency rooms of the hospital with mental health conditions, and we had worked with Common Ground to be able to provide care and get them out of the emergency room, because the intent was to essentially provide them a bed, which then there's all kinds of other things that go on relative to the care that's required through the hospital. So I'd say let's test and learn on this and see if it makes sense longer term, as this issue is going to continue to be here in our county.
Thank you. Commissioner Kuhn?
Thank you, Madam Chair. Is there a particular sunset for this program as it's delineated here before us?
Yeah, the contract is for a year.
1 year from whenever it's passed? And of course, I guess it can be reconsidered once you see what the outcomes are in the course of the year.
Absolutely, yes. And I think that Commissioner Gingell and Chairwoman Lubes knows this all too well. I mean, this is, and Laura probably spends all of her days on these issues. I mean, this is a larger issue and context that we find ourselves in. You may have seen over the summer, OCHN hired a staff person to work directly with hospitals. So hopefully, and we've been in touch with the Oakland County Health Network as well, so that we're all kind of working together on this. So I agree, this can be a very useful, helpful kind of experience for us to learn from.
Thank you very much, and thank you, Madam Chair.
Sure, thank you. All right, any other comments? Roll call, please.
On item I, McGillivray,
Yes.
Nelson,
Yes.
Cavell,
Yes.
Gingell,
Yes.
Kuhn,
Yes.
Powell,
Yes.
Hoffman,
Yes.
Lubes.
Yes.
8 yeas, 0 nays.
The motion carries. Thank you. That
Thank
complete-
you. Have a nice day.
Thank you. That completes our regular agenda item. We move on to public comments. Is there anyone from the public wishing to comment? Please come to the front of the table and state your name and community you reside in, and you have 3 minutes.
Hello.
Hello.
My name is Deanna Jamil. I'm from Walled Lake. I have 2 children. I'm a concerned mother. I also have my master's in social work. I worked for Child Protective Services in Wayne County for 5 years. So children obviously are my main focus, and I want to protect them and keep them safe. I'm going to be talking about the Kochendorfer, did I say it right? Kochendorfer, Commissioner Kochendorfer's resolution that was supposed to be on the agenda at this meeting a few weeks ago. Then it got brought up at the last commissioners meeting last week, and it got moved to another committee now that we don't even have a meeting for, which I thank Mr. Hoffman for bringing it to the attention of the board to hopefully we get a meeting date. And I'm just going to go ahead and read some of the things on this resolution that really stuck out to me. Let's start with, all right, so senior citizens have been and remain the most vulnerable group to severe illness and even death from COVID-19 without vaccination. And whereas with the introduction of widely available and effective vaccines, as well as increased knowledge and research within the medical community, mortality rates, severe illness, hospitalizations in Oakland County associated with COVID-19 have dramatically dropped. And whereas over 71% of Oakland County residents 16 years or older have received at least their first dose of COVID-19 vaccine. Whereas after nearly a year and a half of the COVID-19 pandemic, severe illness, hospitalization, and death continue to be rare in children infected with COVID-19. And whereas NPR recently reported that in states where data available, less than 2% of all children COVID-19 cases required hospitalization and 0.00% to 0.03% were fatal. And whereas in data provided by the White House COVID-19 Team Strategy Executive Group Centers for Disease Control and Prevention dated August 11, 2021, it was reported that only 3.6 people per 1 million people ages 17 years or older constituted new pediatric hospital admissions that tested positive for COVID-19. And whereas a robust study issued by the Centers for Disease Control and Prevention in May 2021, covering more than 90,000 elementary school students in 169 Georgia schools, failed to show that a masking requirement of students generated any independent benefit. And whereas the Director of Emergency Medical Infectious Disease Management at Boston Medical Center, Alyssa Schroeder-Perkins, recently noted the lack of any studies that show conclusively that kids wearing masks in schools has any effect on their own morbidity or mortality or on hospitalization or death in the community around them.
Thank you. All right, anyone else for public comment?
Yeah, we have a list.
The list is for the minutes, so the order that you step up in is fine.
All right.
This is Tasha Shergan from Clarkston. I'm going to finish reading that resolution. Whereas Dr. Shatner Perkins further remarked that there are real downsides to masking children for a long time with no end date and without any clear upside. And whereas in a Detroit Free Press article dated August 23, 2021, Governor Gretchen Whitmer noted that school districts should determine whether to impose mask requirements and that districts in large measure wanted to be able to make those decisions at the local level. And whereas on August 24, 2021, the Oakland County Executive, by and through an order of the Oakland County Health Division, took that decision away from the school districts and their elected boards and unilaterally imposed a masking requirement on over 200,000 students beginning at 5 years old and recommending supervised masking for children at least 2 years of age. And whereas the Oakland County Executive, through the Oakland County Health Division, issued its surprise order with virtually no notice to the Oakland County Board of Commissioners, the county's legislative body. And whereas the Oakland County Health Division presumably issued its emergency order under MCL 333.2453, which authorizes a local health officer to establish procedures to be followed by persons to ensure continuation of essential public health services and enforcement of health laws. And whereas the body of data does not credibly support any finding that mandatory masking of hundreds of thousands of children, some as young as 5 years old, is necessary to ensure continuation of essential public health services and enforcement of health laws. And whereas instead, this is a vast overreach by zealous government officials that ignores the rights of elected school boards across Oakland County, not to mention the prior statement of Governor Whitmer deferring to school districts. And whereas this resolution is not about whether wearing masks is advisable, but is about whether the actions of the Oakland County Executive, by and through the Oakland County Health Division, meet the statutory threshold of MCL 333.2453. And whereas mandatory masking requirements for small children for at least 7 hours a day without any showing that they are necessary to ensure continuation of essential public health services and enforcement of health laws have exposed Oakland County to potential significant liability and costs, including unnecessary attorney fees in a lawsuit the county would likely lose. And whereas these costs were wholly avoidable, and if the Oakland County Executive, through the Oakland County Health Division, would have permitted school districts to continue creating mask policies themselves. And whereas the Oakland County Executive, through the Oakland County Health Division, issued the order with immediate effect and without notice to schools that were already in session, causing needless havoc and illustrating the ill-considered nature of the order. And whereas 9 school districts in Oakland County had already put masking mandates in place, leaving the Board of Commissioners to question why it was necessary to ignore the county's statutory limits and trample on the democratic process at the local level. Now, therefore, be it resolved that the Oakland County Board of Commissioners urges the Oakland County Health Division to immediately rescind its emergency order for control of pandemic issued on August 24, 2021. Be it further resolved that the Oakland County Board of Commissioners agrees with Governor Whitmer's prior statements that school districts should determine masking requirements. Be it further resolved that the Oakland County Board of Commissioners requests that the Oakland County Executive, through the Oakland County Health Division, respect the decision-making authority of elected school boards and acknowledge that they are democratically accountable and capable of creating masking requirements as necessary.
Thank you. Your 3 minutes are up, so wrap that up, please.
I have 2 more paragraphs. Be it further resolved that the Oakland County Board of Commissioners request that the Oakland County Executive, through the Oakland County Health Division, cease issuing any other emergency orders in violation of the county's statutory authority and placing the county at unnecessary risk of litigation and its related costs. Be it further resolved that a copy of this resolution be forwarded to the offices of Oakland County Executive and Oakland County Health Division. Chairperson, the commissioners listed below move the adoption of the foregoing resolution. Adam Kochendorfer, Commissioner.
Thank you. Next for public comment.
Hello again, Commissioners. My name is Catherine Kennedy. I'm from Lake Orion. And this time I'm going to read you some paragraphs from the Constitution because it's not just this county, but there seems to be an epidemic across this country where it seems like people don't actually understand they already have the rights that they're fighting for. So, the first one I'm going to read, it's very short. Amendment number 15. It was ratified in February 3rd of 1870, so it's not recent. It's been out there. The right of citizens of the United States to vote shall not be denied or abridged by the United States or by any state on account of race, color, or previous condition of servitude. So that's very clear. There isn't anybody in this country that doesn't have the right to vote if they're a citizen. Amendment number 14, all persons born or naturalized in the United States and subject to jurisdiction thereof are citizens of the United States and of the state wherein they reside. No state shall make or enforce any law which shall abridge the privileges or immunities of citizens of the United States, nor shall any state deprive any person of life, liberty, or property without due process of law, nor deny to any person within its jurisdiction the equal protections of the law. That's another one that we already have it in the law. Why is it not being enforced equally? This is what I don't understand. All we have to do is enforce the Constitution that already exists, that we've already put in place. Our country is the most generous, welcoming country in the world, but they get taken advantage of. When I was in Europe, it was actually quite eye-opening. The people in Spain didn't necessarily like us, they just liked our money. They didn't know I was American because I'm bilingual enough to fake it. But it was actually a very eye-opening experience. And I've also been in Mexico, in Ciudad Juarez, where the cartel actually literally controls the communities. You can't enter that community without a guide, basically, a Mexican person that can take you through. And there was a plant that I worked with that was there, and that's the only reason I went there. The Jeeps with the federales with the blankets over their faces and just the slits so you can only see the eyes, with the machine guns that are literally bolted to the back of the vehicle facing backwards. Those are real. Those are just on the other side of the border. Yet our own immigration laws are being thrown out the window, and it's at the risk of 100% of our national security. There is nothing that is worse than to have our open border, the crisis devastation in Afghanistan, which our president said he couldn't think of anybody doing it better. I think my grandkids could have done better withdrawal.
So please wrap your
But
comments up.
we, the people, seem to need to read the Constitution, understand what it means, and speak up. We do not want socialism. We, the people, object to all this nonsense policies that are embedded throughout this budget. I actually
you,
wanted
Ms.
you
Kennedy.
to disapprove the entire budget because of all the policies and programs that are instituted quietly in place for us to pay for.
Thank you.
Thank you.
Next for public comment. Welcome.
Hi, Denise Capps. I'm actually from Clawson. I printed out 2 graphs from the Oakland County website last night. The first is the number of COVID cases by I'm sorry.
Hold on just one second.
Yep,
I just want to make sure you get your time.
that's totally cool.
Angela, slide it up. Slide the top notification.
Okay, there you go. Hold on, let me start it over.
I kind of like their feet.
There you go, you can start.
Okay, I printed out some graphs from the Oakland County website. The first is the number of COVID cases by age in Oakland County since the beginning of the pandemic. There are over 20,000 cases for individuals under the age of 20, and then you can see it kind of goes down as the ages get older. The second graph is the deaths by age in our county, with the highest number of deaths being in the 80 to 89 age group. The number of COVID deaths in Oakland County in the youngest age group is 0. There is no column at all for children. The first column listed is ages 20 to 29 with a total of 8 deaths. I will leave these here for you. I would like to know how our health department can justify a health order when our children are clearly not in imminent danger. Also, I repeatedly hear pro-maskers state that the science is settled that masks work. If this is the case, then surely there must be an abundance of studies to support this supposed fact. Yet a year and a half into America's COVID response, the best Leanne Stafford can do is to cite a single study out of North Carolina that didn't even have a control group. On September 2nd, you heard from 2 PPE experts who said it is child abuse to mask children in schools. You have heard stories from parent after parent after parent about how this mandate is physically, emotionally, and cognitively harming our kids. It would be great if Leanne Stafford and Russell Faust attended at least one of these public meetings so we know they are hearing our concerns. But we were openly told, obviously at the end of the last board meeting, that there's no intention of putting it on the agenda, so hopefully it'll make it on the agenda at the pandemic committee. I do not understand why the Board of Commissioners are standing up for unelected government officials rather than standing up for our children. And I don't understand why we can't even have an open discussion about it. This is the 3rd school year that our children, I have 2, have been affected by various COVID restrictions and mandates. They have missed out on school trips, sports, various clubs and activities, their friends' hugs, smiles, and unmuffled voices, and lunch together in the cafeteria. What about having to wear a mask while trying to play a brass or woodwind instrument or to perform in a play or musical? It's beyond absurd, but this is what's happening in our schools this year. How is this keeping our kids safe when they are not even dying of COVID? It's not. The serious damage that is being done to our children is being caused by propaganda, not COVID, and it needs to stop. Oakland County kids are being robbed of their childhood over a disease that has not killed any of them. Please, I urge you to stand up for them now. Thank you.
Thank you, Jenny.
Anyone else for public comment? All right, public comment is closed. We move on to our last item, other business adjournment. So the addition to our agenda is the motion to move the Adam Kokendorfer's resolution to the Pandemic Ad Hoc Committee agenda and a meeting be scheduled within 30 days. I have a motion by
move that
Commissioner
resolution.
Hoffman, support from Commissioner Ginzel. Commissioner Powell?
I have a question.
Sure.
So I have a question for my colleagues. We both know that all the chairs of every committee, of any committee, decides what goes on the agenda. And you all want us to vote this in, just to have it on record, to be just another item of busy work to do, because if Dave Woodward, as chair of that committee, does not pick up this item, it will never get on the agenda. So that is why I'm a no vote, because we know the process, and I just feel like for the residents to be here, they need to understand what's really going on here, and this is smoke and mirrors. Thank you.
Thank you. Commissioner Cavell?
Thank you, Chair. Yeah, I want to echo that for everyone that's here, everyone that's come to our meetings. This isn't, correct. It's a smoke and mirrors thing. It's a ploy. You're being used because the health director works for the executive. We are the legislative branch. The executive, as is mentioned in Kokendorfer's resolution, says using state law, the health director has the ability and authority to do what she did. So you doing this, I appreciate you engaging with the process, but this isn't how you're going to get us to get rid of the mask, because it's not even something the commission can do.
Commissioner Hoffman?
This is a non-binding resolution, like all the other resolutions we pass, but the idea is to represent our constituents and support their position.
Okay.
And we know that we can't tell the health department what to do, and the intention of this is not to tell the health department what to do, but is to take it up, have an honest, open discussion about it. The chairman agreed to put it on this committee before, but then the chairman of this committee, but then the chairman Woodward decided it might be better on the ad hoc committee. So it's gone from LAGO to Public Health and Safety, and now to the Pandemic Ad Hoc Committee. Let's put it on the agenda, let's talk about it, and let's speak our mind and vote it up or vote it down.
Commissioner Gingell?
Thank you, Madam Chair. I just want to continue on Commissioner Hoffman's comment. So I appreciate the fact that the items being brought to this committee with the request for it to be on the pandemic committee. Commissioner Woodward certainly can choose not to put it on there, but I think that's an indication of the game that continues to go on. I've been here a long time, and we all know when you don't want to deal with something, you move it from committee to committee and you bury it. And that's what's happening here. All we're saying is if people are that committed and confident that you think the kids should wear masks all day long at school, put it on the agenda and vote for it. Just say it, right? Philosophically, we can have a difference of opinion. I don't agree with it. I don't like it. But you've got 11 votes and we got 10 votes. Okay? That's item number one. Just vote on it. It's not that hard. Second thing I would say is we as the Board of Commissioners do have an option. And quite frankly, we, and I believe as the chair, because it has to go through the chair, we can have Corporation Counsel write an opinion on the legal ability of the health department to issue the order that they issued. Many of you became aware of documents that were FOIA that Corporation Counsel said, no, we don't believe you can use those articles of state law to make this judgment. I quite frankly don't believe it's a legal health order. I don't believe the health department had the jurisdiction to issue the order they had. And I'd like to have a debate on it. That's what Commissioner Kokendorfer's resolution says. No one wants to debate the issue, right? Take the politics out of it. Is it legal or is it not legal? And in my opinion, give people a choice. I have kids, right?
And I do too.
And if you want your kids to wear a mask and get a vaccine, I'm 100% good with that.
And that's good.
And if I want my kids not to wear a mask and not to get vaccines, I think that should be a position that we're able to talk through and debate. So I appreciate this being on and moving to the pandemic committee. Commissioner Woodward said that they would move it to the pandemic committee and put it on the agenda there. We're just
Thank you.
following through on his comments.
Thank you. I'm not the medical expert. I do depend on the expertise of the health department or any different department. We're not the only county with a mask mandate, and I would defer to the medical staff. Commissioner Powell?
I withdraw my comment.
All right. Commissioner Nelson?
Thank you, Madam Chair. Despite the passionate opinions in regards to what we are talking about, I stand firm with fair and transparent government. Thank you, Madam Chair.
Roll call, please.
On Hoffman's motion, Nelson?
Pass.
Cavell?
No.
What is pass?
Gingell?
Yes.
Kuhn?
Yes?
Powell?
No.
Hoffman?
Yes.
McGilvray?
No.
Lubes?
Yes.
Nelson?
Yes.
You have 5 yeas, 3 nays.
All right, motion carries. That was the last item on our agenda. Is there any other business? All right, at 12:47, and I declare this meeting closed. Thanks, everybody.